The topic today really is the evolution of compliance and the influence of AI.
Place essentially is to enable healthcare providers to achieve consistent and successful compliance, but also for healthcare workers and teams and essentially patients to benefit from that compliance.
From a legislative standpoint or the regulator standpoint, instead of just enforcing these are the rules you need to abide by, it's the understanding that in order for us to, compliance is ultimately a good thing.
Maybe like I think essentially the fundamental thing is really ensuring that you have a solution that's going to bring everything into one place. And because that also increases the already heavy burden that's on healthcare professionals.
All right, good to see everyone. Good to see you all. We've got a great lineup today. The topic today really is the evolution of compliance and the influence of AI. I'm going to be pulling from all of Rob's expertise today, who's not only an incredible entrepreneur, but brings a wealth of knowledge into healthcare across the UK and Ireland. Healthcare partner at Safe Workplace. So quick intros around the table. We have TK Tanaka on the call, head of content at Safe Workplace. He's going to be helping me run this conversation. Ingrid, our head of customer success, who not only has great insight into healthcare herself from her past work in charity, but also personal connections into private healthcare in South Africa. This is the Safe Workplace Compliance Playbook series. And so for those who don't know me, I'm Romano. I'm CEO at Safe Workplace. This series is built to bring in experts from the US, the UK, and the EU in compliance across specific fields to help really bring some valuable expertise that you can use as strategy or to, perhaps think, oh, we're actually doing things the right way ourselves, and we can dig our heels in. And this really is for risk and compliance officers, professionals, auditors, chief medicals, and more within healthcare and medical. So without further ado, Rob, thanks for joining us. Great to have you on the webinar today. For someone that doesn't know you, for our audience, please introduce yourself.
Thanks, Romano. Pleasure. Tanaka, Ingrid. Good to see you today. So I'm Rob Wallace. I'm the healthcare senior partner for Safe Workplace. Just to give you a bit of background, I am a qualified dentist and I've both practiced and owned clinics in Ireland and the UK for about the last 30 years. For many years now, I've had like a deep interest in compliance. I've suppose for my own organization and other organizations I've dealt with. And my role with Safe Workplace essentially is to enable healthcare providers to achieve consistent and successful compliance, but also for healthcare workers and teams and essentially patients to benefit from that compliance. So we would like to get the maximum value from the regulatory and legislative requirements and allow health organizations to benefit from that. So that is my objective within the group, is to make compliance a success.
Fantastic. Thanks for that, Rob. All right. I think a great place for us to start really is, I think most of us have an idea of what compliance is, but in your own words, why is compliant and being compliant important? What are we
I
actually
think,
trying to
again,
achieve?
from my own experience, I think, Romano, sorry, I think that we all know that compliance is a regulatory and legislative requirement, but many things are legislative requirements and hard to achieve. For many years, I've taken the perspective, and within my team here and in any other organization that I've worked with, we've always projected compliance as being a highly beneficial thing, not a burden. So, from a technical point of view, being compliant, it will improve efficiency of an organization, it will improve quality, it will improve standards, but above all, it improves culture. if your organization is compliant. And if you're permanently striving to be compliant, well, then that's beneficial for everybody. Now, on a practical point of view, undoubtedly being compliant has cost benefits, it has efficiency benefits, and it certainly has risk benefits. So, if you can mitigate risk through compliance, well, then your risk of litigation, your risk of incident, your risk of reputational damage, well, that's diminished significantly. So,
Mhm.
these systems are often seen to have been put in place to be a burden. I consider it to be a significant benefit. I think now more than ever, we are accountable
Yeah,
as clinic owners, as healthcare operators. We are accountable. And this is why we need to have consistent compliance across the board.
that makes great. I sort of want to break what you set up into to 2 points really around the cultural aspect, and then perhaps more around the process or operational aspects of how do you have you seen compliance evolve uh, over the last, let's just say, 10 years, 10 to 20 years or so, and perhaps take us back to when you first started out, looking that through, more of an operational and process driven lens, and then perhaps, touching on that, the cultural aspect of compliance culture. How, what have you seen, what has worked well for you?
Well, I think when someone asks me to take me back, it makes me feel very old. But I'm going to take you back. So I'm going to take you back to the 1990s when I started practice in the UK. First, I worked in the NHS, and I also worked in a university in the UK. And yes, there was regulatory requirement in place, but that would now be described as light touch. So we used paper and pen, and a lot of it was based on traditional standards. So if we want to understand the evolution of compliance in healthcare, in the UK, in Ireland, where I am based, and in multiple jurisdictions, around 2008, the introduction of the Health and Social Care Act, that was a game changer because it established the CQC, and following on from that, many other jurisdictions established much more comprehensive inspectorates, regulatory bodies. But I think a problem occurred in 2008. What happened was, after 2008 and multiple subsequent pieces of legislation, 5 to 10 years after that, introduced an onus on healthcare providers to implement compliance with an absolute agreed objective to improve patient outcome. And that is everybody's focus is patient outcome. But the
Mhm.
problem that occurred was there was no guidance given at that time. There was no framework, no pathway. So if you take any compliance officer, risk officer back 10 to 15 years, that would have been an extremely difficult time. But I think now what's happened and why we have an opportunity and why we're having this conversation in the last 5 or 10, in approximately the last 5 years, I think a lot of regulatory bodies, including the CQC and in Ireland, HICWA have done this.
Yeah.
They've decided to collaborate with healthcare. So they've now provided
Mm.
pathways, they've provided frameworks. The JCI provides handbooks, for example. The NHS has recently issued documents, the premises assurance model. So we now have the information and we have the guidance to achieve compliance. So it's an opportunity to take this collaboration and to build new compliance systems. So while it was considered a monumental burden on healthcare workers over the last 15 years, and this is consistent, staff turnover, disengagement,
Yeah.
burnout, and many, many healthcare workers, if you ask them, will not say that it was patient care that caused these problems, that it was patient care combined with very, very onerous burden and
Yeah.
obligation. So, like, I see this, and this is why, again, I'm involved in this. I've seen in my own organization, we have significant guidance and we can guide our teams. And if we can automate this guidance and maximize the benefit from it. So, I would be positive regarding compliance. I think finally that inspectors and regulators want healthcare organizations to be successful when it comes to compliance.
Yeah.
So it's no longer adversarial, in my opinion, or no longer needs to be adversarial. So that's how it has evolved. It has gone from working alone to working under duress and under burden. And I think in the
Yeah.
future we'll be working under a much better structure. this will achieve much better standards. It will ultimately achieve the same thing. Patients will
Hmm.
benefit, healthcare workers will benefit.
Yeah.
That is what any organization should want.
Yeah, I think that it's an interesting. Well, I suppose it's both interesting and very sensible in terms of from a legislative standpoint or the regulator standpoint, instead of just enforcing these are the rules you need to abide by, it's the understanding that in order for us to that compliance is ultimately a good thing, and that in order for us to meet the standards that we want to, we all need to, I suppose, agree and opt into the methods and the means that we're going to go by in achieving that. And that in itself, I suppose, in a landscape creates a bit of culture around like this is the behaviors and the shared things that we're going to do. But if we take that cultural piece and then just touch on it, you mentioned to me in the past how you're very proud of the culture you've created in your own clinics, and so I'd love just to
Mm.
touch on that compliance culture piece that you've personally experienced and sort of how it's worked for you, and how you think, had it been very opposite to the success you had achieved culturally, like where you see the challenges would have been in terms of achieving compliance consistently and at a high standard.
I think Romano culture is the key. So culture is a top-down thing in healthcare organizations. All right. If you see things being done correctly at all levels, and I don't see healthcare as having levels. Okay, in our organization and any clinics that I've operated, we operate on a basis that everybody can have input into our organization. So any member of our team can highlight problems. And also, we ask them on a regular basis what will be beneficial, what is going to make us better. And I appreciate that this is more difficult in an organization with 400 or 500 people, but currently, like we have digital processes to allow every member of your team to communicate with management level, with compliance officers, with risk. And I think many surveys, the NHS survey will show this, a significant number of healthcare workers are still reluctant to engage with their organization. I think that is the culture that needs to be in place. Tell us what the problem is, tell us what you want solved, and implementing any sort of change is coming. So it is unavoidable that automation will enter the workplace, AI will enter the workplace. And if you take the steps to organize or to put in place collaboration before you try to make significant change, then that's where you will see the benefits. And in my organization, I am lucky for 20 years, and I have many people that work with me who have worked with me for 20 years. It is communication, it's collaboration, it's engagement. And the reciprocal of this is poor engagement, poor collaboration. They're detrimental. They're detrimental to any healthcare organization. And I think we now need to use on large organizations. We do need to embrace the tech that will allow us to achieve these improved levels of engagement and
Yeah,
confidence and culture.
yeah, that's fair. I think actually, while we're just on this culture piece, it'd be great just to get Ingrid's opinion on that, because we've had recently some interesting, I suppose, case studies and really alignment with what we believe, at Safe Workplace around culture, and how good compliance culture really influences, well, immediately impacts, high reporting rates and how soon people hear and learn about things. Sayings, what is your, like, just connecting to what Robert was saying, how have you seen that play out most recently in the clients that we work with, and are there any other, I suppose, tidbits and value that you can add to what Robert's saying?
No, for sure. I think sometimes, even from my perspective, I think before really entering Safe Workplace and diving deep into how the healthcare sector really runs when it comes to this sort of thing, you kind of maybe make the gross assumption that compliance and culture are two very different things. But I mean, we recently had such incredible feedback from one of our clients that they sort of flipped my script, saying that this this good culture and compliance are they're completely connected. And they saw massive increase of like 300% in their incident reporting, which I think would scare most people. But in essence, that shows such an important factor that the people in your organization feel confident and comfortable to report when anything goes wrong, no matter how big or how small, giving you instant visibility and
Mhm.
allowing you to identify any issues and making sure that if there is any connection, which a lot of the time there is, to ensure that you are compliant and making sure that all the necessary steps are in place.
Yeah, that's great. I think that's a great way for us to take this conversation into how technology plays a role here. And Rob, you were talking about, you know, we're in a digital era. We have, kind of more opportunities than ever to collaborate and communicate internally with each other in order to achieve our outcomes. And Ing's kind of just touched on that now in terms of like that role of technology. But we think about that evolution of moving from pen and paper to spreadsheets to systems. Uh, how have you seen what technology? How have you implemented that yourself? One, and how do you see that evolution really continuing? Let's just say, or maturing from let's just say the last 5 years to where you see it going to now, and then how really that should help any healthcare organization achieve compliance more consistently and really without more effort or more stress. And
Agree with Ingrid that is culture. Okay, I know we come back to this, okay, but when it comes to compliance, what's happened in the last 5 years, the requirements have expanded quite dramatically. But also there's a slight change now, particularly in the CQC and local authorities. You no longer report when they come to inspect you. So people can now ask for data at any point in time. And
yeah.
regarding care homes and hospitals, there is an obligation to do incident reporting. I think for local authorities and care homes, it's within 24 hours.
Mhm.
And for our own organizations here, it's within 3 days to report specific incidents, let me say. So the problem here is in the past, you would accumulate all of the data for tasks completed, but you would then only analyze the data and see what the outcomes were when either someone was coming for an inspection or you did an annual audit or a biannual audit or something like this. So what we introduced in the past or in the recent past was we record every task. So this has given a lot of value to the work that our team do. So these might be small tasks, they might be things like which are essential, like cleaning water lines, autoclave tests. These are a lot of technical things that always would have been recorded, but now we're recording much more basic things. But what we find is we can look and see where there are gaps where something isn't being completed. We can see it very quickly. And I think because of the change that the CQC are making and moving towards what we would term as continuous compliance,
Mhm.
I think what you need is a system whereby all tasks are completed, all requirements are known. And there's a lot of benefit to this. There's no additional cost to this. I mean, you eliminate duplication, you improve efficiency, no question about it. But what it does is it gives your team, and I keep coming back to the team, it validates the work that they are completing. How many
Yeah.
healthcare workers say, my employer doesn't even know what I do? They may still care what you do, but your employee isn't going to know that if they can see the work that is being done at every level in healthcare. It's essential.
Mhm.
Cross infection control, patient care, audit, all of these things are essential. And I believe that tech now, and I think there's an absolute obligation because the products are available. There's an obligation to record what has been done. And I think that is the way that we're going. It has never interfered with our processes here. So I put the processes in place, and then staff are delegated to enter data related to each process. They don't analyze it themselves. I just simply
Mhm.
take the data, see where we have gaps, see what our standards are like, see what our compliance is like. So I don't have concerns about inspection. If somebody wants to come tomorrow and inspect any of our requirements, well, then that's fine by me. For me, it removes the stress. At my end, it removes, I don't have to go and ask someone, did you do that? It just appears for me. So that's where it will go. It will just become integrated. It will become seamless. It will not increase the burden. This is a major concern with new tech. It's a major concern with change. This will diminish the burden if we can use the tools available to us and engage with staff to use them. No question, no matter how much they expand the legislative burden, I believe the tech can keep up with it now, and that we can simply get on with the job, which is patient outcome. So
Yeah.
that's where I see it going. In a very strong way, I see it going that way.
Yeah, and I think that what's great in what you've just said really also highlights the the accountability, or really the clear ownership. That you can see what's being done, you can see who's doing it, you can see that it's being done consistently. So, at any given moment, if you're being inspected against, I suppose, any data point within the organization, you have no fear or worry really that you're gonna fall short, and because, like you just said, you have that data at hand at all times, and then I suppose the peace of mind that that gives not only yourself but the team too, to know that Rob's doing what he says, Romana's doing what he said he was going to do. We can clearly see it. Ingrid can track everything. She can pull reports at will, and on really, really small levels, day to day things, and then on, of course, like bigger obligations, which is really, really interesting. And so that sort of just digging further into this automation piece of, you mentioned the changes coming into the CQC, right? And of course, there isn't a concrete decision on that inspection review yet. But how can we give people more, like a really practical example of how that automation can play a part in connecting perhaps the obligations, again, quality statements, and the key questions on a day-to-day, on a day-to-day manner, and how small firms perhaps can even take advantage of this now? Because I think what we see internally, or I'd say for workplaces, people only opt for tech or software when they reach 100 employees, 150, 200, and above. I think now it's a time to mature. But really, what I gather from what you're saying is, you bring this on really, really early, and it's going to make your life a lot easier. So could you just sort of expand on that for us?
Yeah, I'm just going to add one last point on our previous point of discussion there. I know I take a very positive perspective to compliance, and I think it's highly beneficial. I probably should also have mentioned that these systems that we're proposing, that I use myself, they can also highlight flaws. They can highlight gaps. They can highlight, unfortunately, people or areas where the work is simply not being done. And quite often that has, again, got very high value, because if you have factual data where you can address problems, well, then it can avoid confrontation. It can avoid conflict. If you try to highlight a problem without what we might call valid data, well, then you can run into a lot of, we would say, HR difficulties. Okay, so that just is a point on the value of collecting data on a continuous basis. Okay. And the system can tell you this task is repeatedly not completed. So that's just to go back to that. Okay. I think from a practical point of view, I think the continuous compliance is something that all regulatory organizations want. And we do reference CQC, but HICWA here in Ireland are the same. Our Health and Safety Authority here, the Health and Safety Executive in the UK, Scotland, Wales, all of these inspectorates are now taking the view that everybody should be consistently compliant on a Monday and on a Friday, not on the 31st of December. Okay. So this comes back again to data. So it's a case for organizations, for compliance officers, for risk managers to identify. It is their job to identify what is required. Okay. So yes, there's a lot of legislation, a lot of requirements to go through, but as I said earlier, this is now being given to us. Pathways are being given to us. So once they do that and you break it down to tasks, examples would be in healthcare organizations, in any organization, fire safety is very important. So that can be siloed. Water safety is very important. That can be siloed. So you may be able to create an overall compliance, let's say score or standard. But if you can silo, if you can break down into health and safety areas, maintenance areas, clinical areas, and then day-to-day function of any facility, let's say for under the PAMs, the NHS PAMs, if you can break it down into silos, then you can have an entire team looking after your compliance. You will still get one ultimate outcome. Is my organization outstanding? Am I 90% compliant, etc.? So from a practical point of view, it's about breaking down what do I need to do, siloing this into different areas, delegating it to your teams, and then letting them delegate it down to their teams. And again, you can just simply use tech to record. It doesn't change the workload. People have been doing this job for the last 50 years. It's just the data has never been recorded. And this is what we found. As soon as we started recording all data, it literally had a monetary value to us. We could delegate staff, we could eliminate duplication, so again, there was no cost to me to do this. There was time cost, yes, but ultimately that was paid back by not having to every day go to someone and say, have you completed this task? Has someone tested the autoclave? Has somebody checked the fire book, etc.? So they are practical things. They're standard day-to-day things from the smallest organization like a dental clinic to a general hospital with 1,000 staff. It is this, we operate in our group to the same standards as our local hospital that has 2,000 employees. So we have the same radiological requirements, the same cross-infection control, the same fire, the same health and safety requirements are applied to us as they are to an organization with 2,000 people. So you need to find a way. But I've always said to people, I want large organizations to feel like small organizations. So if you can do that through tech, well, then you were going to have very, very happy teams and very happy patients. And that, again, all regulation, patient outcome, that is what they want. In every committee, in every issuance of legislation, they will all say, this is about patient outcomes. So they're practical ways, they're simple, practical ways to do it, and use tech, take advantage of it.
Yeah, I think what I take away from what you just said really is there is a cost. We're all bound by the same legislation and law, and there is a cost to, I suppose, indecision or at which stage you decide that data is important to you, and the sooner that we all come to the understanding that the more data we have as soon and as fast as possible, the better our outcomes are going to be from that moment. And so really the cost is how long you're willing to put that off for, because looking at it from, there might not be any tangible costs. We might not see, like, we haven't bought a piece of software, but we don't know what we don't have. If we had the software in place and we had the data and we were able to make decisions a lot faster and people a lot more, I suppose, assured of what they were doing, and we were able to track things more effectively, eliminate that guesswork and make most of our day-to-day workflows a lot more efficient. That's a great real lens to look at that through. And so if we just continue on this and to wrap up this AI piece, we know that it will continue to reduce really that administrative burden. But can you just talk us through, give us a kind of definitive or really your opinion on where do you see it heading to, Like, where do you think this is going to be in 5 years? And how can we start making those choices today? And maybe just this appeals to what you just said previously, so that we can take advantage of things as soon as possible and make healthcare professionals can start making their lives a lot easier and simpler.
Yeah, yeah, okay. So we've chatted about automation today and about AI, and it is very topical AI. But there is also a problem when it comes to AI, and that is that people are nervous about implementation of AI. But there's a fundamental thing, and this comes through. There's a very interesting approach taken by the NHS, and this is what's called their people promise. Okay, and the
Hmm.
basis of that is that healthcare is people providing care for people. And I fundamentally believe that that will never change. So I think that AI will be there and automation will be there, in fact, to enhance the experience of healthcare workers and employees and teams. And I think also enhance patient outcomes. But fundamentally, something has to happen to allow healthcare teams return to caring for patients. This is consistent across the board. So you have burnout, you have people leaving their job, you have staff turnover, and these are caring people who want to do their job. So how I see AI and automation working here is they will remove that burden. So in our organization here, we have an administrative side and a clinical side. Okay. And these have never mixed. So we never allow administrative issues to cross over in. So when a patient is having treatment in any of our clinics, they are the number one priority. But what has happened in large healthcare organizations over the years is administrative burden and compliance burden has made many organizations difficult places to work. Okay. So to get down to the practical side of it, what I would see AI doing is I think undoubtedly legislation will expand. So I think AI and automation is what you will use to keep up with your regulatory requirements. So you will have a system that will basically tell you this is the current requirement, this is what you need to do, this is how you get this data, this is the task that's required, this is the person who needs to do it. And then again, AI will distribute the task to whichever team member or part of your organization needs to fulfill this. The task data will return back through the system to compliance officers, to risk managers, to management, and then it will be up to them to use this data to improve their organization. That burden won't fall on the patient facing clinicians and nurses and cleaners and porters and everybody else that makes health organizations work. So they will be left to do their job. Yes, there will be technical issues, there will be data that will need to be inputted, but again, that can be highly automated. So I see it as restoring the clinical side of healthcare and the administrative side of healthcare, rather than this legislation and compliance has blended these two together. And I think that's been detrimental for healthcare teams and social care workers and everybody involved in the process. And now this is easy for me to say because in a small organization, we can divide quite easily. But in large organizations, to disentangle this, what I would say is a problem, is going to require some pretty powerful systems, in my opinion. And I think healthcare organizations just simply can't ignore it. Like all of the data is there, no matter how hard healthcare workers work, there are not higher levels of compliance being achieved. The results of CQC inspections are simply just not improving. So there is a problem there. So it just simply can't be ignored. So that's my view on it. I think that it's not going to be optional ultimately. And
Yeah.
whichever organizations implement first would be the organizations where people will want to work, patients will want to go, and where they'll see the benefits.
Yeah, That's a great way to sum up. I suppose it's the focus on care and strategy rather than the administrative tasks that make up the 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 compliance of how that care is delivered. I remember seeing what you're saying reminds me of an interesting discussion I heard. I think it was on one of these Harvard reviews on YouTube where one of these CEOs was saying he believes that uh, in the next 20 years, actors will replace certain healthcare professions because actors are good at fake, not, well, I suppose faking or demonstrating empathy and emotion in a way that patients actually want to receive it in, and they'll be able to replace some rudimentary, healthcare operations and procedures with actors because the AI and the machines will help us do it.
I will be retired, Romano.
Fair enough. Fair enough. Ingrid, is there anything else that I've missed that you wanted to bring into the convo? TK, feel free to jump in, ask any questions.
I think something that popped up this week, it tends to go hand in hand, and I think we did briefly touch on it, is that when I was discussing with one of our clients, you realize that so many of these organizations are dealing with like different systems at once, which is they're trying to fill in the gaps for where this system gives me this information. Okay, great. Then I've got this system which helps me do this.
Yeah,
So, and those systems in and of themselves may offer some level of automation, but I think maybe like I think essentially the fundamental thing is really ensuring that you have a solution that's going to bring everything into one place. And because that also increases the already heavy burden that's on healthcare professionals. Now they've got to take the extra time to siphon through 4 different things.
yeah,
I mean, that would do my head in, to be honest. It really takes me back to when I was with the nonprofit, and everything was so. Rob, when you were talking about pen and paper, I remember that. But being in working for this nonprofit, everything was on spreadsheets, and I remember sitting at the desk and trying to get everything from a paper spreadsheet
yeah,
into the system. And then we got iPads, which was revolutionary, which really changed the game. So that kind of took me back to
yeah,
there. So I couldn't even imagine what it's like being really involved in the healthcare space, and now I've got to go through so many different pieces of software.
yeah.
Stressful.
That's a
No,
great.
you're right there, Ingrid. Sorry, man. You're right there, right? There is a problem in healthcare, is that you were reporting the same data to multiple organizations. So you have to, if you have various locations, they all report differently. And many organizations, because integration now, you can have care homes to 200 care homes, for example. Now, they
Mhm.
might be using different systems in different locations. So this doesn't give the oversight that you're going to want. The care homes have to report to local authorities. They have to report to the health and safety executive. They have to report to the CQC, and you're repeating tasks. If you have something that will automate, that will say, "This is our compliance report." So a JCI report will contain vast amounts of data that relate to CQC. Okay, so if you can work out a way that you can take all of this data that you've collected and say, I want a CQC report, and you can automate that process. Or I want a local authority incident report, and you can just say, this is what this looks like, and allow the system to, if you're manually creating all of these different reports using, it is the same data, but it's highly time consuming. So if you can find a way to tailor the requirements of each organization and then just present them with that specific data, it all comes back to data. Data in healthcare, you know, banks use a lot of data, software companies use a lot of data. There's no reason why healthcare can't use data to its benefit and the benefit of patients. It's not, I hate to say it to technical people, it's not rocket science. Because if the tools are there, well, then why waste all of that data? And you talk about spreadsheets. You don't need spreadsheets now. I can imagine this, but and you reflected exactly what it means. It means time. So if you can
Yeah.
eliminate the time and still get the same result and still have insights and still have valid decision making, well, then management teams can make decisions, say, opinions can differ, data cannot. So
Yeah.
you can base your decisions on valid data, and there has been known to be politics in the healthcare setting. And I think introducing data may, in fact, make decision making process just much more efficient and reporting process. Yeah, it's all positive for me, to be honest with you. And it is all right back to healthcare teams and patients. So yeah, I think eliminate the pen and paper, eliminate the spreadsheet, eliminate the burden, basically. Yeah. So I'm in agreement. No more pens. I have a pen, but that's in case we get a power cut. But that's the only thing I use a pen for now. Yeah,
All right.
so that's I think we're just in agreement that the opportunity is there. The
Mhm.
tools are there. Be Safe Workplace, be it another tool. It's about the concept. It's about the concept of putting people back face to face with patients and letting healthcare administration run organizations and let people who want to, everybody wants to care for patients, don't get me wrong, administrators and hospitals do as well. But the level, the increase in efficiency and the amount of clinical work that could be done if you remove this, the reduction in staff turnover, the improvement in culture, the improvement in well-being, it's just across the board. That's just my
Yeah.
feeling on it.
No, I couldn't have put it any better than that, really. And I think on that note, we can probably wrap up. But Robert, thank you so much for your time. I think the
No
eloquence in
problem.
which
Pleasure.
you communicate this real, you know, genuine and integral part that we have to return our focus to our patients and to our level of care, and that the route that we can get there can be made so much more simpler and easier and less burdensome by selecting the right tools and by putting the focus and our strategy in the right place. So thank you so much. Always a pleasure connecting with you. TK Ings, thanks for your time too. And yeah, we'll wrap up this episode and we'll see everyone next time.